Thank you for joining us on the program today.
Thank you for having me.
All right, before we start talking about issues, the problems surrounding family planning in Nigeria, I want you to start with explain to us what exactly is family planning.
All right, family planning is an international method, types of methods that allows a family to decide when to have their children and how many they should have. So in essence, when we talk about family planning, we talk about child spacing
Okay.
and at the same time deciding the number of children to have. So we'll talk about numbers and then the frequency.
Now, how many methods of family planning are there? How many methods are available to couples?
Okay, well, the question of how many is not a direct question to answer because we have family planning grouped into based on either is it modern, is it traditional,
Okay.
is it hormonal, is it barrier?
Okay.
So is it the one for the man or the one for the woman or the one for the two of them?
Okay.
Is it permanent? Is it temporary? Is it long acting? Is it short acting? So there are various classifications. But basically, family planning is broadly classified into traditional method and modern method.
Okay.
So the traditional methods, we have the withdrawal method, we have the calendar method, we have the rhythm method, and so on. But for the modern method, we have those that have to do with barriers,
Okay.
those that don't have to do with barriers, and then we have the hormonal methods.
Okay.
Then we have this we call the copper T, the intrauterine contraceptive device. So family planning methods are as diverse as the number of alphabets that you have in the word family planning.
Okay.
So the most important thing is that we tailor it based on needs and based on choice. So when it comes to family planning, I used to tell people that the choices are quite enormous. There are quite many, and so that's why there is always a family planning method for everyone.
Now, talking about family planning, why is family planning really necessary?
Okay, good. So when we talk about the benefits of family planning, we like to take it from inside to outside.
Okay.
Family planning is beneficial to the mother, it's beneficial to the father, it's beneficial to the child. If we look at the family as a whole, it's beneficial to them. If we look at the society at large, the country, it's beneficial to them. So, and for instance, let me now take it from outside inside. It's been established that countries with very strong family planning uptake have good, healthy economy too.
Okay.
You know why? Because they can decide how many people will be at a place in a particular time in their country at a particular time. It's easier for them to calculate things like per capita income.
Okay.
It's easier for them to plan and say, okay, because of the rate at which we expand, the rate at which we increase in terms of the number of people coming to life every day versus the number of people dying, it is estimated that this place will develop to this capacity within this period. So if we are providing a 10 kVA transformer today, in the next 10 years, we need to increase it to 20 because by then the population would have doubled and so on and so forth. So it allows them to plan. So eventually the economy is better for it. Now, when it comes to the family too, the father is able to plan and say, okay, I have this child, I'll spend this amount of time, money on this child. By so time, I want to have another one. By then, this one would have been in primary school. This is how much I'll have to pay for school fees. And so I can be able to afford maybe baby food and stuff like that and diapers and all of that. So by the time the next one is in secondary school, this would have been in primary school, and then I can now focus my attention and diversify my spending. For the mother, when the mother gives birth to a child, it's a stressful period and requires adequate time to recover before subjecting the body to another physiological change of pregnancy. So when the mother has enough time to rest in between pregnancies, the mother is healthy for it. the mother is able to spend enough time with a child, because as the child is growing, there is this bonding that occurs between the mother and the child if the concentration can be made on that child. But by the time the mother is pregnant and the pregnancy almost starts acting up, and then the child does not understand what exactly is going on. Is this the mother that actually gave birth to me and all of that? Now to the child himself, to the children. So if a child has adequate time to be catered for, has enough money being spent on him, the mother spends quality time, he learns better. The father spends quality time, he learns better, he bonds better, he associates better. So at the end of the day, that child will grow up to be a healthy and an overall sound child, unlike a child that as soon as he's barely 6 months, the mother is pregnant, and so there's pressure on, there's abandonment because the attention is shifting. The one before that one to get old and gets his or her feet on the ground, another pregnancy has come. So at the end of the day, the space is probably not enough for them, and then they all lump themselves up in the night, and it just goes on and on and on. So at the end of the day, one of them will decide to break out and fend for himself and become miscreant, and then the cycle continues. Maybe along the way, he impregnates another girl, and then we keep on breeding those sets of children, a long chain of social miscreants.
And from everything you said, coming home to Nigeria, how do we access the uptake of family planning amongst the populace?
Okay, practically, or let me say scientifically, the family planning indicators in Nigeria are measured every 5 years.
Okay.
In the National Demographic Health Survey. The last one was conducted in 2013. So we're expecting another one in 2018. That will capture the efforts between 2013 and 2018. But in terms of the figures are not quite impressive. In terms of knowledge of a family planning method, it's nationally as high as up to 95%, which means quite a lot of people know that there is something called family planning. But when it comes to the uptake, it's very low. As at today, the figures hover between 15 and 16%. What it means is that for every 100 women who are entitled to use family planning method, that is, they're within reproductive age and they're sexually active, these women, not up to 16 of them are able to, are using a family planning method. And this is not healthy, because what you're going to have when you don't uptake family planning and you engage in sexual activities, you stand the risk of being pregnant. Okay. If you're pregnant, you either have an unwanted child or you procure abortion. In Nigeria, abortion is illegal. So what you have a lot of time is people procuring abortion from the back door, with all its attendant consequences, ranging from illnesses to a complete infertility of the woman to eventually give birth to a child or be pregnant. So when we talk about family planning uptake in Nigeria, generally we must confess that it's quite low compared to even other countries that are not as developed as we think. A lot of other countries are having a contraceptive prevalence rate of up to, that's how we measure the rate at which family planning methods are being used, as high as 70%, 80%. But here in Nigeria, what do we have?
Okay, the general perception is that family planning is low in rural areas. But the question is it any better in urban areas?
When we talk about problems in Nigeria, what we see is buck passing. The attention is shifted chiefly to the government. They say our governments are not doing enough. But then the question is, the little that the government is doing, are people actually going forth to access these services? The federal government has a free family planning policy. That is, if a woman goes to any government hospital, you get family planning for free. But then what do we have? A lot of times, people, the health workers are waiting for women to come, and they don't come. The same goes for private practitioners too. A lot of times, even when the opportunities are there, the uptake is low. So I would share the responsibility among all of us, the community, the people, the individuals, and then the government. Yeah. Because the community also probably does not provide that enabling environment. You hardly see people talk about family planning in the public as part of the gist. They're either discussing politics, they're discussing, gossips, entertainment. Those are the things that are on the lips. So if you gather among your friends now and you say, guys, let's talk about family planning, I'm sure you will get this look of, what are you talking about? And all these make myths and misconceptions spread faster than the facts, because they are not discussed in the open. So it's a hush-hush situation. And when that happens, what it means is that you get to hear more of the wrong information, and then the right information are not pushed out as they should be.
All right, doctor. Now, family planning, we know, has remained low in rural areas. What can we attribute to this, and how can it be improved?
Good. I like answering that question because it's as good as asking which city is best to stay in Nigeria. There is no one size that fits all. So each person would find what suits the person. The kind of lifestyle that is obtainable in Abuja, for instance, is not the same as that which is obtainable in somewhere like Lagos. If you bring a Lagos person to Abuja, it's going to, what is this? If you bring an Abuja person to Lagos, it's going to ask you, where is this? Yeah. So, in the same vein, when someone uses a family planning method, if it suits the body, fine. If it doesn't, there is another one. Yeah. But it doesn't mean that because my friend used this, then it's good for me. Or because my friend, it didn't work for my friend, it won't work for me. So what I tell people is, family planning method is an individual concept. Okay. It has to be individualized, it has to be tailored to each and every person as their needs may be.
Now, doctor, Nigeria is already contributing the second highest levels to global maternal death. What is the place of family planning in preventing maternal mortality?
Maternal mortality is a measure of the number of women who died as a result of pregnancy-related complications, either before delivery, during delivery, or shortly after delivery, traced to a consequence of that pregnancy that they had. So what it means is that the underlying factor of maternal death, the common factor to maternal death, is pregnancy. So what it means is that if we can take charge, quote and unquote, of pregnancy, then to a large extent we would have been able to take charge of maternal deaths. Okay. Statistically, it's been found out that up to a third of maternal deaths in Nigeria can be prevented by family planning. Okay. So what it means is that if, for instance, currently our figure stands at 576 women dying per 10,000 of them, per 100,000 of them. So what it means is that if family planning is optimal, we can have it cut to up to 1/3 of that. Okay. So what that means is that 30% of our maternal deaths can be reduced if we can improve on family planning. Why do we have low family planning uptake in rural areas? Good. Now, the rural areas in Nigeria have their peculiarities, and all these, in a way, unfortunately, have worked against uptake of family planning. But the truth is, we can decide to turn the table and still use those peculiarities in favor of family planning. For instance, we talk about generational, handing down information from generation to generation. If what my mother tells me is that family planning is not good, there is every likelihood that I'll accept and I'm not going to take family planning. If my mother says the more the number of children you have, the better for you, that's what I'm going to believe in. So in the same vein, All I need to do is break the chain and tell this mother that family planning is good, and is going to tell her daughter that the family planning is good, or tell her, this woman, that you need to decide on the number of children you want to have and when to have them. And the same message is going to be passed down. Okay, you're taking me to finding the solution, the other part of your question. And it is effective information, education, communication, and counseling when it comes to family planning. Now, people think that passing an information is as simple as spreading the message. No, it's a two-way thing. So if I talk to you about certain thing, I'm expected to get a reply from you that would inform me whether you understand what I'm saying or not. So if you don't, I'll come back and re-explain and clear the doubts, and then we'll be on the same page. So what I'm trying to say is that when it comes to such information, we need to shift our attention to the client. We need to focus on the client and not necessarily the message, or just ticking the box that, okay, I went to this community today and I spoke to them about family planning, done. On to the next one. No. So I need to, like I said, family planning has to be individualized. So even if I talk to people en masse, I'm supposed to get a feedback from them, or find another session to engage them one-on-one, so that I can get the feedback and clear their doubts. So a lot of work still needs to be done when it comes to information. However, remember I said that family planning, the challenge of family planning is a shared responsibility. The reason is that some studies also show that some women get to some facilities, especially in those rural areas, and they don't have access to these family planning methods. I know places in Nigeria that you need to trek as far as 100 kilometers before you're able to access family planning. This we know is not something easy. So even if I get convinced, the thought of having to go that far to access service would likely discourage me. And who knows, that evening, the woman can get pregnant. Unwanted pregnancy, unwanted child. So as much as we will increase sensitization, increase awareness of family planning, we also will increase the service. Not just service, the quality of service. Because if I provide information and it's not adequate, it's not appropriate, it's not concise enough, and probably it could even have a negative effect on the community or on the person that I'm expected to talk to. So it has to be, everybody has to take up their responsibilities, see it as something that needs to be done, and then be more committed. Focus on the client, focus on that woman that needs this service. And as soon as that is done, we will all have a better family planning figures in Nigeria.
No, according to statistics, back in 2013, the National Bureau of Statistics revealed that family planning in Nigeria remained low due to lack of contraception materials and effective campaigns for child spacing in urban and rural areas. From your own knowledge, what's the situation right now?
Well, like I said, the real figures of family planning is estimated, is calculated, assessed every 5 years. So the 2013 figure you have is about the most authentic figure that we have as at today, and the next one will be done next year. But there are a few other studies that have shown that we've, to a large extent, moved from where we were in 2013 to now, because there are some other organizations that are following the trend every year. We're not where we planned to be. Our plan was that by the end of 2018, we would have achieved a contraceptive prevalence rate, like I said, the measure of how many people are using family planning, of up to 36%. Okay. But as of today, we're not even quite at 18%. Okay. What this means is that we cannot move from 18% to 36% in 1 year. So already our target may not be met. But then, like I said, we are not where we used to be as at 2013.
Now, Doctor, what is the way forward? We've outlined a whole lot of problems as regards family planning in Nigeria. What would you suggest as the way forward as regards family planning uptake in Nigeria?
Way forward is that we should first and foremost accept that family planning is still a challenge in our environment. We're not yet there. Next is that we should all accept that we all have a role to play in changing the trend. After this, each person would now identify their responsibility and tackle them. What do I mean? The government will ensure quality, efficient, sustainable service delivery at all these facilities. If possible, go to the communities. I mean, there is a process that went in before immunization becomes a door-to-door or became a door-to-door activity. So there is nothing stopping the government from finding a way to ensuring that every woman has access to family planning. So this will require training of health workers. Not all health workers can provide family planning service. Not even all health workers can provide counseling. You will be shocked. So we need adequate training and retraining and continued, because there are trends happening every day. So someone who was trained 20 years ago needs to be retrained because a lot has happened after then. Now, for the community, we need to be more liberal and face the fact that family planning is something that we need to discuss. As long as we procreate, as long as we give birth to children, and we know that these children don't just come about, we should not be ashamed to discuss all these issues to ourselves, to our children, to our young women, because we also found out that the contraceptive prevalence rate is least among young women. So we all talk about catching them young. So if a young girl can have a child, but you don't want to talk about family planning, and then has an unwanted child, you have jeopardized the future of that child. So we need to start this and be more liberal, be more realistic that this is something we need to talk about, and this is a service that needs to be provided. And each and every one of us as individuals need to also see it as a responsibility. Know that the decision to have a certain number of children and at what time, at what interval, is your right. Yeah. And for every right, there is a responsibility.